So what is it then? What do we mean when we say a patient engagement platform? So there are lots of, I've seen it, lots of descriptions, if you like. This is the one I like the best. I think this covers off all of the aspects. So it's a secure platform. Yeah, clearly we need to be sure that the patient data is safe, allowing patients to control aspects of their care. We have evidence that the more we can engage people in these interactions, the more they commit to them and the better their outcomes. To have access to their own records and to enhance the experiences for individuals and providers alike. So what we're trying to do is take the rough edges off those spaces where we interact with our patients or service users. We're not to replicate the functions of some of the GP online systems where what we're trying to do is just expose the medical record to a patient. What we're trying to do is provide digital services which make things better. So an example I have here is we'd like to do kind of smart appointment notifications. So, a patient gets a notification probably on their phone, but on an app or on a PC, wherever. So they get a notification that we've created an appointment for them. And right there and then, we want to give them the ability so they can say, yes, that's fine, I'm coming. Or, no, actually, that appointment doesn't work for me. Simple one-click, yes or no. Yes, I can come, no, I can't. And if they're not sure, well, let's give them the ability to export that appointment into their calendar, into their calendar of their choice, and just say, okay, can I go that day, can I not? But get that feedback straight away, rather than somebody reading a letter and think, no, actually, I don't know if that works, I'll have to check that later, and then they forget. Let's give them that ability straight away to just say, yes, I can come, no, I can't. That message will flow back to the originator. And again, conversations we've had with some of the groups, that if when they, if what they got was a notification that, absolute identification of which patient, absolute identification of which appointment they're not, that makes it so much easier for them to rearrange rather than having to hunt around for, well, which person is this, which appointment are we talking about? So we're just trying to smooth those interactions, if you like, with digital services that just make things a little bit better for everybody. Obviously, to do that, we have to expose some of their medical information, and as we develop more services, we'll show them more and more their record. But just to make the point that this project, what we've got in mind, isn't just about taking the records that we have in hospitals and social care and just exposing that. That's not what we're about. So what do we think we're going to do? What do we think we're going to include in phase one? We have a roadmap. We have a roadmap of features that people have suggested. We've run some of this past patient groups and broadly get approval. I think the one thing we didn't suggest, but which is very popular with the patients, is can we please include in the app the ability to pay for my car parking? We're not sure that that's going to be possible. But what we do expect to do in phase one is registration, obviously, give people a way to sign up. As I say, appointment information, let's do some smart work around appointments. Let's send correspondence, so let's stop sending people paper letters. Let's see if we can deliver correspondence electronically. And we'll gather some preferences about the app, preferences about the way you want us to engage with you, preferences about, are you prepared to engage in research, that kind of thing. We can gather those preferences straight up.
Greenmail's got a question. Are you taking any questions during the presentation, or are we keeping them till the end?
Let's try now, but if we start to run out of time, then we'll save them till the end.
Okay, Graham?
Yeah, it was just a quick one, just with what you were willing to include with regards to appointment reminders and correspondence. Is it secondary care? Is it primary care? Is it all?
So you'll see when we get there that we're in a position now where we're going to expose a lot of this through NHS app. So NHS app already has a mechanism for displaying GP appointments. And we expect that that will be held separately to the information that we provide from Great North Care Record. But from Great North Care Record, anybody who joins, yeah, it will be about whatever appointments they wish to send. So if it's a local authority appointment or a community appointment or a hospital appointment, yeah, if we decide to send it to the engagement platform, it will do whatever it needs to do, and we'll then expose that through the NHS app.
Great, thank you.
So yeah, so we're trying, in the centre, we're trying to kind of build a set of capabilities. Yeah, each trust, I guess, then gets, you know, some choices about how much they use that. It's similar with correspondence. You know, if we build a capability that allows us to receive that letter electronically and share it with the patient, each organisation obviously has some choices over which letters they choose to send that way. We'd like there to be as much standardisation across the region as we can, just so that patients don't get confused. You know, well, Newcastle are sending me this kind of letter, but North Tees isn't. So we'd like there to be as much standardisation as we can, but clearly each organisation is in control of the data that it shares to the engagement platform. Looking further ahead, then we'd like to build on those foundations. We know we want to do some work about patient demographics, questionnaires where, you know, we'd like to do some kind of dynamic form so that if ahead of an appointment we want to start gathering information from the patients, let's see if we can do that in a smart way. Disseminating test results through the app, and then a bit further ahead, perhaps, you know, can we do file transmission? Can we get information from any health equipment that the patient has? Linking in with remote consultations. I have this dream that we'll have people saying, Alexa, tell Newcastle Hospitals I'm coming to my appointment today, but we'll see how that turns out. And then again, you know, engagement with and selection of people who are willing to engage in research. So that's our roadmap. Part of phase one, as well as kind of delivering the thing which does those things in phase one, we also have to finesse the roadmap. So part of the design work, you know, engaging with patients will be which of these future modules that we could do, which order do we want to do them in, what do we want to put in phase two. As I say, is there something in there that, you know, absolutely shouts out that we haven't done that we should be doing? We might even do some research into car parking, but we'll see. So why would we want to do this? I think it's almost self-evident, isn't it? I mean, if we ask ourselves, you know, when was the last time you actually went to the bank, or when was the last time, you know, you actually went to an estate agent, rather than using mobile banking and Expedia and the like. So I think in, you know, the rest of our lives, people are now expecting to do these kind of things on a mobile phone, on a tablet, and I think, you know, that's a place where we want to be. But there is evidence that if we can keep people engaged, if we can keep communicating with them, they take more accountability for their own health. They stick on they stick to the advice we've given them more readily. As I've said, we want to improve the patient experience, but also the experience for ourselves. Let's smooth out those rough edges. But we'd really like to see this reduce wasted appointments, and here we're not just talking about kind of did not attend, but trying to do away with where somebody turns up for their appointment, but they've taken today's medication when we didn't want them to, or they were supposed to go nil by mouth at tea time yesterday and they didn't. Well, if we can start providing some smart reminders, 6 o'clock at night, don't forget you should have nothing to eat now till you've been to hospital tomorrow, or 8 o'clock in the morning, please don't put your contact lenses in, you're going to the ophthalmology department today. If we can provide some of those smart reminders, then we should reduce wasted appointments. And last but not least, I guess, is every letter we send saves us money. Every letter we send electronically saves us money. We spend millions of pounds across the region sending letters to patients. If we can save even 20% of that we save hundreds of thousands of pounds. And we've set ourselves a target of over the next 5 years doing away with 50% of the letters that we send to patients. Some of that cost, some of those savings are what we'll pay for phases 2 and 3. So while it's last on the list, we ought not to forget how important it is. So how did we get to this point where we're launching the project across the region and asking everybody to join in? So it was in 2008 was when 2018 was when I first got involved here at Newcastle, and we had a project at Newcastle to devise some kind of patient portal, as it was then. It became clear though that other organisations were running similar projects and were thinking along the same lines, and there was a regional discussion, I guess, about did that make sense, or should we all pool our resources and put together a regional project that we could all use. So that led to some work in the latter stages of 2018, where a panel of mostly chief information officers or their equivalents or deputies thrashed out a collated and a consolidated specification of what we thought the patient engagement platform should look like. That led to a tender exercise. Tender documents went out early 2019, and as they do, that process took some time. And again, a regional panel reviewed all the bids. We had presentations from a number of the potential suppliers, and in Q2 last year we selected a partner. That's Enigma Interactive. I think they're on the call, and we're hoping they'll have something to show us a little bit later on. And I'm hoping that because I'm hoping we can get the technology to work, not because I'm hoping they'll have it ready. But we were really pleased. Enigma Interactive are based in Newcastle. They're based on the quayside, and we really like that idea that this platform is going to be built in the north for the north. You can then see there's a huge gap between us choosing the partner and actually awarding the contract. That was largely to do with the centre NHS Digital morphing into NHSX, and NHS England were almost playing hide and seek with the money. Money that we thought they'd promised us in 2018. Once we got into 2019 financial year, was it coming, was it not? Held us up for several months. And then the money finally came through. We awarded the contract towards the end of last year. And then through this early part of this year, we've been working with Enigma. We've been doing some kind of detailed work around the scope, translating what was in the tender documents into, what does that actually mean? There have been some changes. Graham alluded in his introduction to the fact that we're now working with NHS App. I'll describe that in a minute. Although I'll do it now. So when we started, we spoke with NHS Digital about the NHS App, and they were pretty clear that at that stage, the NHS App was only interested in primary care. It was only interested in showing GP data and interacting with GPs. And if we wanted to do something else, then largely we were on our own. So we went back, if you like, and said, well, that's okay, but can we at least use the NHS login? Can we use that as an identity layer so that, we're not asking people to identify twice, once for the GP data and once for their hospital data? And those conversations started, and we were working with NHS Login about how we could integrate with them, which led to a further discussion with NHS App, where they had not quite made an about face, but had realised, I think, that trying to do everything on their own wasn't quite going to cut it, and that they needed to provide the ability to expose services from other providers. At which point we said, oh, well, can we be one of those providers? And we described to them what we were doing and the scale of what we had in mind, it being the whole region and not just for a single organisation. And they very quickly said, "Oh yes, that sounds interesting. We would love to work with you." So that has had an impact on obviously what was in this tender documents. So we've been thrashing all that out with Enigma, and that's led us to today, where we think we're at a point now where we pretty much understand what we think it looks like, what we need to ask, what we can show you, and what we can ask you to do to start getting involved. Because when we do launch, we'd really like this to be a regional launch. With the HIE, we've definitely phased it. So, there were a number of trusts who've gone early, and then there'll be phases of trusts which come behind that. With the patient engagement platform, we'd like to do it all together, so that when we launch, it is truly a regional product and not just a product for one or two organisations.